you stand right here. All right. Good afternoon, everyone. My name is Tom Skinner. I'm a Senior Public Affairs Officer with the CDC in Atlanta. I'm joined today by Dr. Christopher Braden, that's spelled B-R-A-D-E-N, who is the lead for the HHS CDC team here at MCAS Miramar. Dr. Braden will provide some opening remarks regarding HHS CDC efforts to help ensure the health and safety of the repatriates at Miramar, as well as steps were taken to protect the health and safety of the surrounding community. He'll then answer your questions. For the Q&A, he'll be joined by Carolyn Thorman from the Administration for Children and Families. When we get to the Q&A session, please raise your hand. Dr. Braden will call on you, and if you will state your name and affiliation prior to you asking your question, that would be great. He'll try to answer as many questions as time will permit. Before we get started, I want to introduce Greg Cox, who is the chairman of the San Diego County Board of Supervisors, who would like to make a few remarks, and then we will turn the podium over to Dr. Braden. Mr. Cox.
Thank you, Tom, and on behalf of the County of San Diego, thank you all for being here this afternoon. As chairman of the Board of Supervisors, I'd like to take the opportunity to welcome you to this media availability on a topic that I know is front and center on everybody's mind right now. The County of San Diego is hosting this event, but I want to make clear that the National Center for Disease Control is the lead agency on this issue. We have with us today several individuals that are going to be talking. We have a lot of our county top executives that are here from the public health offices in a supporting role. And I want to reassure the public that we are working hand in hand with the Center for Disease Control and all the other federal agencies, and as we try to address the issues around the coronavirus. Protecting the public's health is the highest priority of the County of San Diego. And all of us working together, I think, is a good sign at the local level, the state level, and the federal level that we're on top of this. We know it's a very serious issue and one that the public has a lot of concerns about, and that's why we're having this session here today. So without any further ado, let me introduce Dr. Braden.
Thank you, Chairman Cox. I do really appreciate the support that the county has provided to the mission. We couldn't do it without that support. Thank you again for joining us today. My name is Dr. Chris Braden, and I'm the lead of the team of the Centers for Disease Control and Prevention, along with the Assistant Secretary for Preparedness and Response and the Agency for Children and Families. We are responsible for helping to ensure the protection and health of the evacuees from Wuhan, China, their families, and communities across the country. As you know, the evacuees will be staying in housing at the Marine Corps Air Station here at Miramar during their 14-day quarantine. I'm happy to report that the plane touched down safely earlier this morning. The passengers are currently undergoing health screening. There are a total of about 170 passengers. Don't quote me on the exact number because that's an estimate right now as we go through the check-in and screening process. They are happy and relieved to be back in the United States. They've had a very difficult experience, and we are doing everything possible to care for them. Because these individuals were in Wuhan, the epicenter of the outbreak, where there is intense and escalating community-wide spread of this novel coronavirus, we consider them at high risk of exposure. Medical personnel have been screening and monitoring these passengers every step of the way, including before takeoff, during the flight, and now following their arrival. This includes checking temperatures and observing for respiratory symptoms. Medical monitoring will continue for the remainder of their quarantine, and everyone involved in the response will be following guidance suited for their duty to ensure their health and safety as well. Anyone showing signs of illness consistent with the novel coronavirus during the quarantine period will be transported to a nearby medical facility for isolation, evaluation, and care as needed. We know this situation may be concerning to people in the Miramar base and surrounding community. However, based on our experience with other coronaviruses, we don't believe these individuals pose a risk to the community because we're doing all that we can to take the measures to minimize any potential exposures. With coronaviruses, person-to-person spread occurs mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory viruses spread. These droplets can land in the mouth or nose of people who are nearby and possibly be inhaled into the lungs. And these are people who are nearby, very close, and likely for prolonged periods of time. So infections occur mainly from close, unprotected contact, that is within 6 feet for a prolonged period of time, like I said, with someone who is sick with the novel coronavirus. The public health measures CDC and the government are taking, including this quarantine, are science-based. They constitute measures to carry out the public health strategy to detect and contain as a way to protect our nation. CDC staff have spoken with the evacuees at Miramar, including myself. We explained to them that they are under federal quarantine orders. The quarantine will last 14 days from when the plane left Wuhan, China. 14 days is the extent of the incubation period for this virus. This is the first time in more than 50 years that CDC has issued a quarantine order like this. While we understand this action may seem drastic to some, our goal today, tomorrow, and always will continue to be the safety of all Americans. We are in a critical time period in the international spread of the virus, and this action is necessary to try to prevent the spread here in the United States. It is our mission to try and ensure everybody's safety and well-being. Before I take questions, I would like to reiterate that everyone has a role to play as we work together to contain the spread of this virus. Everyone should stay informed. The best antidote for fear is reliable information. CDC is updating its website daily with the latest information and advice for the public. Additionally, remember to take everyday precautions to preventive actions that we can always recommend to prevent the spread of respiratory illnesses. Stay home if you're sick, cover your coughs and sneezes, wash your hands, and get the influenza vaccine every flu season. We have extensive guidance and information at our website at www.cdc.gov/ncov. We recommend visiting the site regularly for updates. We'd now be happy to take questions. Okay, I'm going to start with you in the back, white hat.
Yes, sir. I'm Dr. Scott Gottlieb, the FDA Commissioner, prior FDA Commissioner.
Yes.
In today's Wall Street Journal says, so far 11 known U.S. cases of recent travelers to Wuhan and our household contacts, but it's highly probable that dozens of other cases have gone undetected. Again, that's Scott Gottlieb writing in today's Wall Street Journal, former FDA Commissioner.
Mm-hmm.
I'm Kevin Cox with NBC News.
Yes, yes. So you wanted my comment on his comment about probable unidentified cases. So let me just say this. We cannot seal borders. It's impossible to do. We will take all the actions we can to detect and contain. We will continue to do so, and I think we've been successful to date with, for instance, the 11 known confirmed cases. Those cases have been identified early. Any contacts have been identified, and they continue to be monitored. We've had no deaths in this country. So I think that we have been successful in this detect and contain strategy to the extent possible. And this is a strategy we will continue to pursue. This is a little bit different than a different kind of public health strategy, which is a mitigation strategy, which is what we would do, for instance, with the seasonal flu virus. We are still in the public health strategy of detect and contain in this outbreak. Yes, young lady.
What is life going to be like for those people who are at the base right now? What will those 14 days look like?
Yeah, so they have a fairly large area within the quarantine borders. There are actually 2 sites on base. They are allowed to go where they like in the quarantine area. We don't have any recommendations that they wear protective equipment like a face mask or other types of protective equipment. We will be suggesting that they maintain some social distancing, about 6 feet from one another when they can. Of course, that's not going to happen if they're within families, for instance. If it makes them more comfortable to have a face mask, they're welcome to wear that. They're going to be provided 24/7 medical care in medical facilities that are within the quarantine area. The Agency for Children and Families is also assessing their needs for any other types of things that we need to provide for them. I mean, it is a difficult situation. These are people who may have lived in China for quite a long period of time. They're allowed 70 pounds of luggage to carry back with them, and they'll be here for who knows how long. So there's not very much that they have in the way of their personal belongings, and so we need to do what we can to make sure that they are well cared for, and to the extent that we can, that their stay is pleasant. Yes, here in the purple shirt.
Hi, Gabby Rodriguez with NBC7 in San Diego, and Salma the Twain, also my
Mm-hmm.
Two questions for you, if I may.
Yes.
One is the facility equipped to handle children?
Mm-hmm.
And the second is how do family members of people that are within the facility know what facility their family members are and get in contact with them?
Let me see if I understand your question. So there are children, some of them young. I know I just saw them coming off the plane, and you know, they're looking to have some stability for a while because it's been a hard journey for them. We will be housing families together, either in the same room or if they're larger families, adjoining rooms. And again, they're allowed to explore the quarantine area. One of the quarantine areas has a playground that was already present on the base. We hope to be bringing in playstations for children in the other site. So we hope to provide for children and that they will have somewhere where they can play and grow while they're here.
And what about how do family members find where they're at? Because I know that we've heard from some family members that are hoping to find out what base their loved ones are.
Oh, I see, family members from outside.
From outside, yeah.
Yeah, so all these folks likely have cell phones. They have access to the internet. They can talk and communicate with their families whenever they like. There's no restriction on that. Okay. Let's go over to this side, on the floor over here. Sir?
If I can ask 2 questions. Could you elaborate a little bit on what their daily life is going to be like, what kind of recreational opportunities you'll have, if you like movies or library or anything like that?
Yeah. Yeah, so I also had the experience of standing up operations at March Air Force Base. So that I have a little bit more experience with those groups of evacuees. Of course, these folks are just getting here. But in any case, for instance, I mentioned that they will have access to free medical care that's within the compound. They will have breakfast, lunch, dinner, snacks. I will be meeting with them every day to answer questions and so forth while they're here. Also, as I mentioned, the Agency for Children and Families will have a case worker for every family or person to determine what their needs might be. We can meet them. There is also some non-government organizations and volunteer organizations that are really very happy to provide some other types of creature comforts. Yes.
I'm sorry, my other question was, some families or people were allowed to Travis Air Force Base today. I'm just curious, how was that decision made to separate who would go where?
Yeah, so I know that basically who went where depended on which plane they were on. And I know they kept families together, but for instance, there was there was an experience today that the first plane coming into Travis had a family on that plane, but additional family members were on the second plane. So the second plane was originally not going to be deboarding passengers, but in this case they did in order to keep that family together. And that's why you'll learn that the plane coming here to Miramar today was delayed coming into the airport. So we tried our best to accommodate families. Yes, ma'am.
Similar question. So I know they were not separated as family, but it didn't matter if they had someone in San Diego or in Berlin or in Colorado.
Oh, I see. Yeah. I don't think that was taken into account. You know, basically, the logistics of getting these folks on a plane and into these bases around the country, these 4 bases that we've identified so far, and getting them housed and so forth. When their quarantine is over, they will be provided, you know, transportation to airports to continue on their journeys. If they are not able to, for some reason or another, do that on their own, I know the Agency for Children and Families will provide that service to them. Hey, Chris. Yes. And can you add that?
Really quickly. Yes, Caroline Thorman with the Administration for Children and Families. I just want to reiterate a few things that Dr. Braden just mentioned. First of all, we are so thankful to the community in San Diego and on the Miramar base for all of the support and contributions they've already made. We've been working with the San Diego County, with the Red Cross, and the base organization. So first of all, I just want to say thank you guys so much just for being the community that you are. Just a few things to note. We are, as our leading agency on repatriation efforts, we are helping facilitate all the needs that these families might need. So if they want playing cards to, you know, the quarantine, basketball court to playgrounds to just all of the recreational activities that these families might need so they can have a pleasant and welcome stay at the base. So again, I just wanted to reiterate that we will be providing medical needs, transportation, and any of these necessities that these families might not be readily available to have. So thank you.
Thank you. Let me see, go over here to the checkered cup.
Can you confirm if there was any person or family that it's from here, from San Diego, that were in these planes?
Yeah, I don't know that, ma'am. Yeah, sorry. Blue shirt.
Yeah, can you just confirm whether anybody on either one of the planes was showing any symptoms in the process of getting here? And once they're here, if for some reason they do start to show symptoms, does that restart the 2-week clock for everybody?
Yeah, no, so they were checked leaving China, and they had medical personnel on board. So if they had symptoms or other worrying signs in China, they weren't allowed to board. And I don't know if there were people like that that weren't allowed to board. I don't have that information. Right now, they're still undergoing evaluation as we speak. As I said, you know, the plane was delayed coming here, and so I had to do my job to help them get into the off the plane and into the quarantine area, and Tom brought me over by car just after that. So more to come on that as we continue to do our evaluation. And your second question was?
If we get like a week from now.
Oh, yes, right. So what we'll do, certainly there are 2 sites, okay? If there's somebody who becomes symptomatic in one site, it doesn't affect those people in the other site. What we'll try and do is we'll determine, you know, who are the real contacts around a case if they exhibit symptoms, and we'll assess those people to determine whether they really may have been exposed and whether or not further quarantine is needed. But it's not a blanket policy. Okay. In the back, yes, ma'am.
Can you tell us the age ranges of the patients that are here, and also can we expect any additional flights?
I know that there are infants on the flights, and there was some elderly adults on the flight, so I can't give you the exact age ranges right now. And the second question was?
Expect any additional flights to MCAS Miramar?
Yeah, so there is a plan that there would be additional evacuees coming to Miramar. However, I'll have to just emphasize that this mission changes, if not by the day, by the hour. So we already know, for instance, that we were expecting many more evacuees on this flight than actually came in. So maybe there's not the need for additional flights coming out of Wuhan at this point. So, but just like I said, there was an original plan for an additional flight to come here, but keep yourself posted on whether that's really the case. Yes, sir.
You mentioned that you saw the evacuees today.
Yes.
Seeing them daily. How do you avoid infection yourself?
Yes. So thank you for the question. So we have guidance for all the people who have different functions within the quarantine area. And certainly, if there are functions that would have close contact with the patients, especially if it's medical care, for instance, then there's what we call N95 respirators and goggles, gloves, and gown. Some people that will be spending some time with them fairly close and doing interviews and determining what their needs are, then there's a little bit less protective equipment, just a surgical mask, goggles, and gloves. When I go in, I know they're being monitored all the time. Nobody is symptomatic that we've identified, and we know that kind of on a continuous basis, 6 feet distance or so. And I talk to them. I don't wear any protection. And I'm very comfortable with that. Let me see. Yes, ma'am, in the back.
Yeah, my question is, I thought there was supposed to be more than about 170 people coming to Miramar. Is there a reason those people got off the flight in Travis?
No, well, there were, like I mentioned, there were some family members that were, but the big difference, we expected quite a few more. And I was surprised that there were actually 170 versus 290 or so that we were at first expecting. And so I didn't have information about why so many fewer persons were on the plane. And so I was asking some of the passengers, I said, why do you think there's fewer of you here? And this is just what people had to say. But they thought that actually for some people, they may have signed up to come and be evacuated, but then it was a very hard decision because they're leaving family behind. And maybe they changed their mind and didn't end up coming.
So follow up on that. So there were 290 people on the plane from Wuhan to...
Correct. So there were many fewer that got on the plane in Wuhan.
Originally, there weren't 120 that got off the plane.
No, there were a few people that got off the plane in Travis just to rejoin a family, but that was it. Yeah.
So just to follow up that, can you provide us again the numbers, how many departed from Wuhan and how many are expected?
Yeah, so I would like to, I need to be very careful about the numbers. I want to be correct. We're going through and we've got them all off the plane and now we're going through their screening and we'll have the numbers for you. But, I said it's about 170. Give me some latitude there on that number, okay? Yes, sir.
I know that you guys, last night you guys had a chance to talk to some of the families on base at Miramar. I know you were talking about that there were some concerns. What were some of the concerns that they brought up? What were some of the questions they had for you guys?
Oh, the passengers when I was talking to them, or?
No, I was told that the CDC did a briefing with families at Miramar on base yesterday. What were some of the concerns?
The families on base.
Right,
Yeah, no. So as we expected, there's people who are concerned, and they're concerned for themselves. They're concerned for their kids. They want to know, is the school going to somehow say your child can't come to school or something like that because they live on the base. So I tried to explain to them a little bit about the virus, how it really is transmitted. It is a novel coronavirus, but we actually know many other coronaviruses and know much more about them, so we do have knowledge to fall back on. And so, I think that's what I really tried to emphasize a bit, is giving them the knowledge to make them more comfortable and make decisions for themselves.
And I know, like, just follow up on that, I know on social media, we're seeing some things people in San Diego are saying, why do we have to bring them here? Why can't we
Yes.
send them to somewhere like Alaska or something like
Right.
that?
Yeah.
I mean, how do you mitigate some of those concerns?
Yeah.
Just generally, is there a risk to the public right now in San Diego here?
Right. So, number one, I know that people are concerned for, especially their kids, is what a lot of the concern is about, but for their own safety and so forth too. And I recognize that. I get it. But again, trying to give them the correct kind of information so that they can be more comfortable. And, as I said, I think we've been pretty successful in identifying cases in the United States. I understand that we theoretically, there are other people that could enter the United States with this virus, and we haven't detected it. But if there were ongoing community spread of this virus, we would know it. And that's not happening, okay? So right now in the United States, communities across this country are at very low risk of being exposed to this virus, including in San Diego and including on this base. Yes.
Kind of a follow-up to his question.
Okay.
Is there any activities or anything on the base you asked them to suspend while the quarantine's going on?
So this is from the DOD. The staff on that base and all the bases involved are under orders not to interact with these passengers, and that's for a number of reasons. They're hyper concerned about force protection. I get that, but also it's for the privacy and dignity of the passengers. That's like the Colonel says. This is they're guests on this base. This is not a zoo. We need to provide a place where they can have that privacy and dignity while they're here. Yes, in the back.
Are there only American citizens that were on board, or there are Chinese nationals as well?
Yeah, so American citizens, and there are some family members of American citizens who are not citizens.
And what was the criteria for evacuation? Was it just being in the city of Wuhan?
So yeah, the Wuhan or the province of Hubei, because the virus is actually transmitting in many towns in that province. So they are able to qualify for evacuation, American citizens, family members of American citizens from that area. Yeah. Yes?
So we know the original plan is for them to stay 14 days. But
Yes.
if needed, would they stay longer there if needed?
So I'm going to answer that question in two ways. Number one, the 14 days is the extent of the incubation period. There would be no need for them to stay beyond 14 days, given that they're well, and there's no risk that they would be developing disease after that time. Okay. But if somebody asked before if they're a contact to a case and close contact for a prolonged period of time and so forth, it may be that we would want to monitor them for a longer period of time. Do you see what I'm saying? So yes, it's possible if they have a contact to another case. And let me say another thing, and you probably recognize this, but the situation is fluid. We're learning more about the virus all the time. We still don't know all we want to know about how infectious it is and how easy it is to transmit among person to person. And so policies are changing as we know more. So not necessarily having to do with length of quarantine and so forth, but many other types of policies that you're seeing may change.
Risk is very low risk.
Okay, two more questions.
Why do you think that there's so much hysteria if it's so low risk? Why are so many people concerned about it? Why
Yeah, so there's some scary things about it. When we say it's a new virus, we don't know a lot about it. When we engender the memory of SARS, not too long ago, we actually had some cases of Ebola in this country. And then there's the Hollywood genre about contagion, all working together, I think, to heighten people's concern. Yes.
At first, you mentioned that one of your recommendations, besides washing your hands, was taking the flu vaccine. Because of this hysteria, what would you recommend to the community that is in this paranoia right now to take the flu vaccine could maybe help?
So the reason I said that is because I think the general community is at more risk of developing a severe flu illness than they are of any exposure to this virus as it stands now. So that's why I said if you want to help yourself and your family, get the flu vaccine. That's probably a higher risk for you in the community. And of course, there's general good hygiene, whether it be cough hygiene and so forth, hand hygiene, that protects you from lots of different types of pathogens and respiratory illnesses that are likely also more of a risk than any exposure to this virus as it stands. Okay.
Will there be any time on February 18th that you say, okay, we've hit the 14-day mark, or is it just, like, is it noon on?
Yeah, so, I mean, technically speaking, there's going to be a time where they're going to be able to leave the base and the quarantine order is lifted and so forth, but in reality, 14 days is 14 days, so yeah, okay, so, okay,
That's good.
all right.
Thank you all for joining us. Please realize that if we have additional briefings, hopefully we'll have them here like this if our folks will allow. Captain Gregory at Miramar will continue to be the channel in which we distribute information to you all about additional briefings. So stay tuned and thank you. You have my number, my email if you have any follow-ups. Thank you very much for coming.